Okay, so our question was around in adults with a pre-diabetic state, which is defined as an A1C level between 5.7% and 6.4%. What impact do lifestyle changes, increased exercise, and dietary changes have compared to their current lifestyle on their A1C levels? So pre-diabetes is a condition indicated as a sustained level of a hyperglycemic state that's lower than the threshold for type 2 diabetes, which is 6.5%. The CDC estimates that 88 million people age 18 or older have prediabetes, or that's 34.5% of the population. Of those with prediabetes, each year, an estimated 5 to 10% develop type 2 diabetes, with the majority eventually developing it, particularly those who are overweight or obese. Adults over 25 years of age with increased A1C levels between 5.7% and 6.4% have a greater likelihood of developing type 2 diabetes and the complications associated with that, such as kidney failure, delayed wound healing, and increased susceptibility to infection and heart disease. So the methods that we used to draw our conclusions were our search terms included exercise, nutrition, diabetic diet, and education. And we used the self-care theory to guide this literature review. Our focus was on the individual and their ability to perform self-care and provide education about interventions that they can do to lower their A1C levels. Um, and we found that if the pre-diabetic patient does not perceive the benefits of lifestyle changes in nutrition to lower their H1C level, then they have a risk to progress to type 2 diabetes.
So the main implication for nurses in regards to this study is education for the pre-diabetic and newly diagnosed diabetic patient. Education can be overwhelming for these patients, so education should be in small, frequent sessions. Increased education leads to increased self-efficacy, which is the main indicator of prevention and treatment compliance. In conclusion, the self care theory suggests that a person wants to be well and will make the changes and put forth the efforts necessary if effectively empowered to do so. Empowering and educating our patients, as supported in the findings of this literature review, shows that when armed with the correct education, goals, and empowerment, patients can effectively make the changes necessary for them to improve their pre diabetic state. Through knowledge and empowerment, many individuals can achieve weight loss and diabetes control. More research is still needed to evaluate the best practices for lifestyle changes.